If you're an older man who still masturbates, I need you to hear this because there's something almost no one tells you. In fact, it might be the one thing that's silently making your erections weaker, your sensitivity lower, and your confidence fade. Not because you're doing it, but because of how you're doing it. My name is Dr. Sophia Jain. I've spent over 20 years helping men over 60 reclaim their energy, their intimacy, and their inner strength. And I can tell you, this is one of the most common yet least understood issues I see week after week in my clinic. Most men think masturbation is either good or bad, right or wrong, black or white. But the truth is much more nuanced and way more important than most people realize. Because while self-pleasure can support your health, it can also, if done the wrong way, quietly chip away at your performance, your hormones, your blood flow, and even your emotional connection to others. In this video, I'm going to walk you through 10 hidden risks of masturbation after 60 that most doctors never talk about, and more importantly, how to turn this private habit into something that actually protects your prostate, improves circulation, strengthens testosterone, and deepens your sense of intimacy. And before we wrap up, I'm also going to give you a natural, science-backed 7-second technique that I share with my patients, one that helps restore firmness and desire safely, effectively, and without the need for any prescriptions. So let's get into it, because your health and your confidence deserve the full truth. Before we dive in, if you haven't subscribed yet, go ahead and tap that button. Turn on the bell icon so you never miss important health insights, all made specifically for men in their 60s and beyond. And hey, if this video speaks to you, type 1 in the comments. If not, type 0. Your feedback matters. It helps me create content that truly supports you. Now, let's talk about the first risk, one that most men never see coming. Because the danger here isn't just physical, it starts way deeper. The first hidden risk of masturbation after 60 is one I've seen silently erode the emotional well-being of countless men, and yet nobody warns you about it. It's not really about your body. It's about your connection to the world around you. Risk number 1, social isolation. I remember a patient, a retired high school teacher, 67 years old. He had this quiet heaviness in his eyes, not the kind that comes from age, but from being invisible. After a few minutes of polite conversation, he leaned forward and said, "Doc, I haven't touched another person in months, but I still take care of things on my own. Is that bad?" That question stuck with me, not because of the act itself. There's nothing wrong with self-pleasure when it's done with balance and awareness. The problem is when it starts becoming a replacement for real human connection instead of a complement to it. Many men in their 60s, 70s, even into their 80s, slowly drift into quiet routines. Masturbation becomes a comfort, a way to feel something, even for just a few minutes. And without realizing it, they stop reaching out for connection, emotionally, romantically, even socially. What started as a private act becomes a daily replacement for conversation, affection, even friendship. Slowly, masturbation fills the gap until that gap becomes a canyon. It's not just about sex. It's about slowly withdrawing from life, from hugs, from laughter, from eye contact, from feeling seen as a man and not just a patient or a retiree. I've seen men lose the will to date, to touch, to engage, because solo pleasure became easier than facing the vulnerability of real intimacy. And here's the truth most people won't say out loud. Physical touch isn't just about feeling good. It's medicine. It keeps your emotional circuits alive. It keeps testosterone active. It reminds your body that you matter. When you stop reaching out, your world starts shrinking. Not because you're older, but because you've stopped believing that anyone still wants what you have to give. If you've noticed that you're turning inward more and more, and your private time is the only connection you're experiencing, that's not a failure. It's a signal that you're wired for more, that more is still possible. Reclaiming that connection doesn't have to mean chasing romance. It could start with something as simple as calling an old friend, joining a local men's group, or even just saying hello to a neighbor you usually pass by. Intimacy isn't just about touch. It's about being seen, being heard, being human. Because the moment we stop believing we deserve closeness is the moment we start calling isolation independence. Now, while emotional distance is one risk, the next one is physical, and most men don't even know they're doing damage until it's already done. Let's talk about the second hidden danger. Risk number 2, skin microlesions. Not long ago, a man in his early 70s came in with something that embarrassed him. He said, "Doc, I've been getting irritation down there after and it's getting more frequent." I could hear the hesitation in his voice, like he felt silly for even bringing it up. But here's the thing, this is more common than most older men realize. As you age, the skin of the penis becomes thinner, more sensitive, and slower to heal. You lose collagen and elasticity. Now combine that with decades of friction, especially if you're masturbating without enough lubrication or using the same technique over and over, and you're likely to get what we call microlesions. These are tiny tears or abrasions in the skin, and they can lead to irritation, pain, and over time, even scarring. Most men don't notice it at first. Maybe a little redness, a slight sting, or sensitivity that goes away after a few hours. But when this happens again and again, it causes low-level inflammation. It can even make sensitivity worse over time. In some cases, it opens the door to bacterial or fungal infections, which thrive in warm, moist environments. And here's the worst part. Many men think that discomfort means they have a hormone issue or a nerve problem, when the real issue is technique. So here's what I tell every man over 60 who comes into my office. Masturbation isn't supposed to hurt. And if it does, it's not because you're broken. It's because your approach hasn't evolved with your body. First, be gentle. You're not 25 anymore, and that's not a flaw. It's a call to treat your body with more care. Second, always use a quality water-based lubricant. Not lotion, not petroleum jelly, and definitely not spit. A proper lubricant reduces friction, prevents tearing, and actually helps preserve sensitivity. Third, slow down. You're not racing against the clock. This isn't about finishing fast. It's about being present. This stage of life isn't about less pleasure. It's about deeper, more meaningful pleasure. There is nothing embarrassing about changing the way you touch yourself. In fact, there's wisdom in that. You're working with your body, not against it. And that's the kind of masculinity that gets stronger with age. Now, if friction and irritation are warning signs you can feel, what about the dangers you can't? What if I told you there's a hidden risk that doesn't affect your skin, but your brain? One that slowly teaches your body to stop responding to real-life intimacy altogether. Let's talk about it. Risk number 3, desensitization. He was 64, healthy, still working part-time, and sharp as ever. But when he sat in my office, there was a heaviness in his voice. "Doc," he said, "I can still get there on my own. But when I'm with my wife, it just doesn't feel the same. Something's off." Now, in cases like this, the issue isn't always hormones or circulation. Sometimes it's what I call the quiet rewiring of the nervous system. See, when a man masturbates the same way over and over, same grip, same rhythm, same pressure, same fantasy or scream, his brain begins to associate pleasure only with that exact combination. It's like carving a deep trench in the ground. Every time you pour water, it flows down that same path. Over time, it forgets how to flow anywhere else. This is what we call desensitization, And in older men, it often shows up as struggling to get aroused with a partner, needing more intense stimulation, or being unable to climax unless you recreate that solo experience exactly. What used to feel natural now feels like a chore, and that leads to frustration, confusion, and often a sense of shame. But I want you to hear me clearly. This isn't your fault. It's not a moral failure. It's not a weakness. It's just conditioning. And the good news is, it can be undone. Start by changing the way you touch yourself. Try varying the speed, change your grip, use different positions, and most importantly, engage your imagination. Step away from screens when you can. Use memory, fantasy, emotion. Let your brain stretch again and slow down. Don't race to the finish. Explore. Learn what feels new. When you create variety, you retrain your body to feel again, not just in the skin, but in the nervous system. And here's something I tell every man who walks into my office with this issue. Your nervous system isn't broken. It's just been trained too narrowly. What it needs isn't judgment. It needs patience, permission, and time to relearn. I've seen men rediscover their intimacy after years of numbness, not with pills, not with procedures, but with curiosity and care. You don't need to stop pleasuring yourself. You just need to expand how you do it. Now, if desensitization affects how your body processes pleasure, the next risk is even more dangerous because it can hide something far more serious. Let's talk about the risk that can mask a life-threatening condition. Risk number 4, masking erectile dysfunction. I met a man in his late 60s, fit, active, married for decades. But something had been bothering him for a while. After we sat down and talked a bit, he opened up. I can get hard when I'm alone, Doc, but with my wife, it just doesn't happen. So I've kind of stopped trying. Now, that's not just about performance. That's a red flag. What he assumed was just a mental block was actually his body sending an early warning signal, possibly about circulation, nerve health, blood sugar, or even testosterone levels. Here's what most men don't realize. The penis is often the first place your cardiovascular system shows signs of trouble. When arteries stiffen, when blood flow slows, or when hormones drop, erections are usually the first thing to change. And because masturbation is easier, with less emotional or physical demand, many men think they're fine. They're still functioning, just not with a partner. But that assumption can delay important treatment. Solo arousal doesn't test the full system. You don't need as much blood flow, as much nerve sensitivity, or as much emotional engagement. So your body can hide deeper problems for months, sometimes years. But the good news is, if caught early, many of these issues can be improved or reversed naturally. I've helped men recover their performance by improving their circulation, balancing hormones, and reducing inflammation, all without jumping straight to medications. And here's what I want every man over 60 to understand. There is no shame in needing help. The danger is in waiting. If you've noticed your erections are weaker, don't last as long, or disappear during intimacy, but stay strong during solo time, that's a clue worth listening to. Don't dismiss it. Don't mask it. Talk to someone. A good physician won't just look at your symptoms. They'll look at your whole life, your stress, your sleep, your blood pressure, your habits. You deserve a full picture. You deserve to feel like yourself again. Now, if that risk hides quietly in your blood vessels, the next one can sneak up through something much simpler, your posture. And yes, even the way you sit can cause long-term damage. Let's talk about that next. Risk number 5, nerve compression from poor posture. He was 70, thoughtful, soft-spoken, and he said, "Doc, I don't know what's going on, but I feel numbness down there. Not pain exactly, just like less sensation." We ran a full set of tests. No circulation problems, no infection, no prostate concerns. But after looking at how he spent most of his days, hunched in a recliner, leaning forward during private moments, I knew exactly what was happening. His posture was compressing the pudendal nerve. That's the nerve that carries sensation from your penis, perineum, and pelvic floor. And when that nerve gets pinched or irritated, you start to feel less, sometimes for hours, sometimes permanently. Men who sit for long periods, especially in hard chairs or bent over positions, are at risk for this kind of compression. Over time, it leads to numbness, tingling, even pain. And most guys assume it's their hormones when it's really just mechanics. But the good news is, once you understand it, it's easy to fix. Start by changing how you sit. Avoid hard chairs and slouched positions during masturbation. Try lying down, reclining with a pillow behind your knees, or even standing with a soft bend in your knees. This supports your spine, reduces pressure on the pelvic floor, and protects your nerves. Also, don't stay seated for long stretches throughout the day. Get up, stretch, take walks. Motion brings circulation, and circulation brings sensation. I always tell my patients, comfort isn't indulgent, it's intelligent. How you treat your body during private moments echoes in how it performs during public ones. So give your nerves space to breathe, and your body will thank you for it. Now, while posture can quietly numb your body, the next risk is even subtler. It's what happens when masturbation stops being physical and starts becoming emotional. Let's talk about what happens when it becomes your only coping mechanism. Risk number 6. Using masturbation as your only emotional outlet. I once had a man in his late 60s look me in the eye and say, "Some days I just get tired of feeling. Masturbation helps me shut it all off." And I understood him. He wasn't chasing pleasure. He was chasing relief from loneliness, from boredom, from grief, from days that started to feel gray and unchanging. And when life loses color, sometimes the only spark left is behind a closed door. The truth is, yes, masturbation lowers cortisol. It temporarily boosts dopamine and oxytocin. It helps you feel calm, loved, even connected. But when it becomes the only way you process emotion, it becomes a trap. You skip the phone call, you cancel the walk, you avoid the hard conversation because the easier path is right there. But easier doesn't always mean healthier. And over time, that pattern narrows your emotional world. What begins as a coping strategy can become dependency. And dependency, even when it feels harmless, robs you of options. It trains you to numb instead of feel, to withdraw instead of express. Now, I want to be crystal clear here. There is no shame in needing comfort. Every man deserves relief. But if masturbation is the only tool in your emotional toolbox, then it's time to add a few more. Start small. Talk to someone, a friend, a counselor, a group of other men walking the same road. Move your body daily. Create routines that pull you toward the world, not away from it. Because as powerful as orgasm may feel in the moment, it doesn't replace purpose, it doesn't give you identity, and it doesn't satisfy the human need to be seen, heard, and needed. You deserve more than temporary escape. You deserve a life that offers connection, strength, and peace. And when you build emotional strength, you become more resilient, not just in the bedroom, but everywhere else too. And while emotional escape can dull your inner spark, the next risk is one that weighs on the body itself. It's physical, it's constant, and most men don't see it coming until one day there's a dull pressure that won't go away. Let's talk about what happens when too much of a good thing builds up without rest. Risk number 7, pelvic congestion. He was 68, recently retired, liked gardening, reading, and keeping to himself. But lately, he said, "There's this weight between my legs. It's not sharp, but it's always there, like a pressure." We ruled out infection. His prostate was fine, but when I asked about his habits, he told me, "Since I retired, I have more time. I do it once, sometimes twice a day. Helps me sleep, helps with boredom. Now, here's the thing. There's nothing wrong with self-pleasure, but the body, especially after 60, needs rhythm. It needs rest. Frequent ejaculation without enough time to recover can cause a condition we call pelvic congestion. It's exactly what it sounds like, a traffic jam of blood and inflammation in the pelvic region. When this happens repeatedly, your tissues get irritated. You might feel heaviness in your testicles, an ache behind your pubic bone, soreness that hangs around even after release. And the fix isn't about stopping, it's about pacing. Think of your body like a high-performance car. You wouldn't redline it every day and expect it to run perfectly. It needs cool-down time, refueling, maintenance. For most men over 60, spacing out your sessions every few days instead of daily can reduce that lingering pressure and actually improve how strong and sensitive your erections feel when you do engage. And don't forget, when you allow time to build anticipation, you often experience deeper satisfaction. So the pleasure doesn't go away, it deepens. Let your body speak and listen when it asks for rhythm over repetition. Because you're not just managing urges anymore, you're managing energy, vitality, and balance. You don't need to white-knuckle your way through abstinence. Just give your body time to reset, and it will reward you in return. Now, while pelvic congestion comes from physical overuse, the next risk shows up where very few men ever look: your fertility. Yes, even at 60 or 70, this still matters for many, and what you do in private can impact your future in a big way. He was 61, newly married to a woman 10 years younger, excited, hopeful, but after 6 months of trying, they still weren't pregnant. Everything seems fine, he told me, but maybe it's my age? Now, his labs looked good. Hormones, testicles, prostate, no red flags. But when I asked how often he ejaculated, he smiled and said, "Pretty much daily. Sometimes more. It helps me sleep." And I get it. Many men believe frequent ejaculation keeps the pipes clean, so to speak. But here's what's often missed. Sperm concentration drops with frequent release, especially in older men. When you ejaculate daily, your body doesn't always have enough time to fully rebuild quality sperm. The result? Lower concentration, reduced motility, and yes, lower fertility, even if everything else is working fine. Now, this isn't to say daily ejaculation is bad, not at all. But if fatherhood is on your heart, even just the possibility, timing becomes crucial. Studies show that abstaining for just 2 to 5 days before trying to conceive can significantly increase sperm count and strength. Think of it like filling a reservoir. If you don't give the tank time to refill, it can't give you full output.
Especially for men in their 60s, who already experience a natural decline in sperm production, this recovery window becomes even more important. So, if you're hoping to create life, or even preserve your chances, it's not about stopping. It's about planning. Waiting those couple of days could make all the difference. Because fertility isn't just physical. It's emotional. It's symbolic. It's a powerful reminder that your body can still generate something extraordinary. And that capacity doesn't fade with age. It just needs intention. So if fatherhood is on the table, give your body the time it needs to give you its best. Now, while that risk matters deeply for those considering children, the next one impacts nearly every man I speak to, regardless of age, goals, or relationship status. Because it's not about your body. It's about your mind. Let's talk about a silent rewiring of the brain that's happening in men everywhere, especially those spending more time alone. Risk number 9. Disconnection from reality. He was 70, widowed, with a calm but empty look in his eyes. He said, "It's not that I don't want a partner. I just don't feel anything anymore. Real intimacy doesn't do it for me like it used to." He wasn't struggling with testosterone. He wasn't dealing with nerve damage. What he was describing was something far more modern: brain desensitization from artificial stimulation, especially from porn. See, the male brain is wired to respond to novelty. New faces, new curves, new scenarios. That's how evolution built us. But digital content hijacks that system. It delivers endless novelty on demand. Fast. Unrealistic. Perfect. Over time, your brain gets conditioned to expect that level of intensity. And real life, soft touch, eye contact, skin that isn't airbrushed, starts to feel flat. It's not your fault. But it is your responsibility to retrain your mind if you want real connection again. Because the longer you rely on fantasy, the harder it becomes to respond to reality. And I don't just mean sexually. I mean emotionally. When real women start to feel less interesting than the ones on your screen, that's not about lust. That's about neuroplasticity. You've trained your brain to prefer fantasy. But the great news is, you can reverse that. Your brain isn't stuck. You can rewire it. Start by cutting back on the digital stuff. Take breaks. Use imagination, not always imagery. Let memory guide you. Let anticipation build again. Read something sensual. Reflect on real experiences. Talk to a real person. Reclaim the art of slow arousal. Learn to savor, not scroll. Because your capacity to connect deeply never truly goes away, it just gets buried. But it can come back stronger, richer, and more powerful than before. Now we've explored 9 powerful risks: social, emotional, physical, neurological. But all of that leads to one final truth. Because masturbation isn't the enemy. The problem lies in how you use it. So now, I want to show you how to turn this private habit into something that protects your prostate, improves blood flow, balances hormones, and restores confidence, all in just 7 seconds a day. Let's talk about what I give my patients when they're ready to heal, grow, and reclaim what they thought they lost. Now, we've explored 9 powerful risks: social, emotional, physical, even neurological. But all of that leads us to one final truth. Because masturbation, in itself, isn't the enemy. The real danger is in how it's being used, or rather, how it's misused. And that brings us to risk number 10, disconnection from reality. This isn't about your body anymore. This is about your mind, your connection to life, to people, to meaning. I had a patient, early 70s, smart, articulate, lived alone. He said something that hit me like a brick. I just don't get excited by real connection anymore. It's easier to stay in my head. That wasn't a confession about sex. That was a cry from the soul. He didn't lose interest in people. He lost his capacity to respond to what's real. Years of private habits, digital imagery, and no emotional challenge had slowly stripped away his ability to feel something genuine. And that's more dangerous than low testosterone or poor circulation. Because when your brain becomes so conditioned to fantasy, the real world feels dull. Human touch feels awkward. Real bodies feel less than. And eventually, real intimacy just disappears. This isn't just about porn. It's about any pattern that trains your brain to expect easy stimulation without effort or vulnerability. Your nervous system adapts. It gets bored by what once moved you. And suddenly, nothing satisfies. The good news? It's reversible. The brain is plastic, it can rewire. You can bring back sensitivity, curiosity, and the thrill of reality. How? Start small. Take breaks from artificial stimulation. Replace it with memory, imagination, or real-life experiences. Let desire build. Let anticipation live again. Stop numbing and start noticing. Because when you give up chasing instant gratification, you start discovering something richer, slower, deeper, more fulfilling. Real connection. Real intimacy. Real life. And that's what this entire conversation has been leading toward. You've now seen the 10 hidden risks of masturbation after 60. Risks like social isolation, skin irritation, desensitization, masking ED, nerve damage, emotional dependency, guilt, pelvic congestion, lowered fertility, and disconnection from real intimacy. But remember what I said at the very beginning, this isn't about fear. This is about awareness. Because knowledge gives you power. And now that you understand the risks, I want to share something that has helped hundreds of my patients. It's a natural, 7-second daily technique that works with your body, not against it. It doesn't involve pills, prescriptions, or expensive treatments. Just a bit of consistency and the right mindset. Let's talk about it. So now you know, masturbation after 60 isn't good or bad. It's not black or white. It's a tool. And just like any tool, how you use it determines whether it builds you up or breaks you down. We've talked about the 10 real risks that can creep in if this private act turns into a silent pattern. From emotional withdrawal to physical injury. From pleasure numbness to relationship distance. From hormonal imbalance to nervous system stress. But none of this means you need to stop. It just means you need to adapt. Because this chapter of your life isn't about quitting pleasure. It's about reclaiming it with wisdom. When you adjust your habits, when you become conscious of how, when, and why you engage with yourself, you don't just preserve your health. You restore your power. You're not too old. You're not broken. You're evolving. And evolution doesn't mean less, it means better. And if you're ready to take things one step further, if you've been feeling stuck, sluggish, or disconnected in your intimate health, then I want to offer you a method I've personally used with hundreds of men in their 60s, 70s, even 80s. A simple, natural technique that takes just 7 seconds a day, and can radically improve your circulation, prostate health, firmness, energy, and confidence. It's safe, drug-free, and designed specifically for men in this stage of life. You don't need insurance. You don't need a prescription. You just need a willingness to try something new. And when you do, you may wake up one morning and feel something you thought was gone for good, vitality. If this conversation spoke to you, then don't just scroll away. Don't go back to the same habits that left you feeling half alive. This is your moment to reclaim something powerful, not just erections, but self-respect, energy, confidence, and purpose. If you're interested in learning this 7-second method, click the link below or check the pinned comment. This isn't hype. It's not gimmicks. It's the exact method that's changed the lives of men just like you. Because your best years are not behind you, they're still ahead. This is Dr. Sophia Jain from Sage 70. Stay strong, stay aware, and I'll see you in the next video.